Gloria Rivera. Thank you so much, Gloria, for starting to touch upon what you do. And I think it's super fascinating that you are a doctor by trade. And so a lot of times what we find in our profession as interpreters is that sometimes the providers, the doctors, don't necessarily understand our perspective. So I love that you are, Gloria's rolling her eyes now, everybody, but, but I love that you guys, specifically you, Gloria, that you have both backgrounds. And I think that would put you in a very unique position as an interpreter. So can you tell us a little bit more about that?
I think that what I bring to the table is I help. It's funny because we're supposed to be a conduit of information. So I feel I do that between the provider and the interpreter. Because, for example, sometimes I've seen people that don't have training and they just summarize, for example. And I've had patients complain about it because some people think that because a patient doesn't speak English, they don't understand English. And in most cases, they do understand. And then they complain and tell me, I didn't like my other interpreter. And I'm usually very curious and I just tell them, can you please explain? Because maybe it's something that we're not supposed to do because of ethics. So I can diffuse that situation. Or maybe it's something that the interpreter was doing wrong, right? So I can put it in my group so it doesn't happen, of course, keeping names out. And she told me because she lets me talk a lot. She's not like you that I have trained them to just give me short sentences because I do a pre-session because as you well know, Berthine, pre-session is important.
I believe in it.
Preaching to the choir, Berthine, preaching to the choir. So, yeah, she told me I can tell that she's not saying everything I'm saying. So when I have a webinar or a recorded webinar about ethics, and I tell them we're supposed to say everything. And they're like, yeah, but you know what? Sometimes the patient says things that are not necessary. Okay, they may not be necessary to you, but to a provider, it may be what changes the diagnosis or what changes the treatment. You know, that little bit that you thought is not that necessary, maybe what changes the course of his patient's treatment and prognosis and livelihood. So that's one of the things I know. And that, or for example, there's another one that this interpreter told me, I just changed the register. And I asked her, what do you mean by that? Because again, I like clarifying and understanding before I explain. Oh, well, if a doctor says diplopia, I just say double vision. Okay, but why are you doing that? Because the patient's not going to understand. And then I ask her, okay, first off, why do you think the patient's not going to understand? Second, why are you taking away the right from the patient of not understanding? They have the right to understand and not understanding. And third, by you lowering the register, the doctor doesn't realize that he has to lower the register. So that's the problem. And you're trying to be a nice person, but the problem is, what if the doctor throws a high register word and you make a mistake when you're lowering the register? So that's a problem you're putting on yourself, that it doesn't even belong to you. So that's the type of thing I try to explain to people, because sometimes people think that meaning well means, oh, the poor patient is not going to understand, or meaning well is the doctor is using big words that I'm going to mince and give it in a smaller bits and pieces to the patient. And by doing that, you're not being a good conduit, and they're not communicating directly. And that can open the door to a lot of problems.
I completely agree. I completely agree. Carmelina, what are your thoughts on that?
I agree, and this is why we wanted Gloria as our guest, because you know, when you teach language neutral, this goes to Spanish, English, or indigenous languages as myself, and even like in your language also, Berthine, which is Creole. And we all understand that. We're all on that same level in that effect, because when it comes to our you know, when we're interpreting, you know, you can't change, you know, what someone said, because that's not what you're supposed to do. And so then this is why we wanted Gloria to be our guest, because we want to help other interpreters, new interpreters, so that they understand the reason, you know, like, and a lot of people say, well, but I have to be, be a cultural broker also. But there's a difference between cultural brokering and changing the message. So, this is why it's so important to have guests such as Gloria, so that we empower our new generations, because that's what it's about. This is why we want to do this, and this is why we want to continue your legacy, is because we want to continue empowering and educating interpreters, so that we all are on the same level, and so that we all keep this profession as it should be in professional.
Wow, I could not have said that better at all. So I won't even say, I couldn't have said it better myself. I could not have said that better at all. So, well, I want to say this to me is just the best foot for us to begin again that transitional phase, to let people know that, the work goes on, the work has to continue, and it must never ever stop. And I see this a lot of times in the profession, where somebody will think that, they've been an interpreter for X amount of years, and they forget about continuing education, right? And so I know Gloria is going to jump out of her seat right now, just like I am, just like Carmelina is, right? We're going to jump out of our seats, because we understand the value of continuing education. So